Dr. Berg, and welcome to the GI Health Summit. Thank you so much for being here.
Thank you so much for having me. I'm very excited to be here.
Well, I can't wait to dive into this topic because it hasn't been discussed before. I know you're going to talk about the naturopathic approach to SIBO, but before you do, could you please explain to our viewers exactly what SIBO is? And please feel free to go into as much detail as possible.
Okay, thank you. And I actually think this is very important to start out this way so that the rest of the presentation makes sense. And so what SIBO is, it stands for small intestinal bacterial overgrowth. And we are supposed to have most of our bacteria, our good bacteria, in our large intestine. So we have our small intestine first, and then the large intestine. We're supposed to have all the bacteria we hear about, the microbiome down there. We do most of our digestion of our food, though, first in the small intestine. And so with SIBO, you basically have food or overgrowth of bacteria in the small intestine that shouldn't be there. And there are various reasons for why this can happen. But what happens is when those bacteria are there, where you're doing most of your digestion of your food, they are eating that food. Primarily, it's the good whole food starches and carbohydrates, unfortunately, and because they love that food too. And they eat it, and then they produce gas, pretty much just like humans. The problem is when they produce that gas, they're not supposed to be there. That gas is not supposed to be there. And so then you have the bloating and all of those uncomfortable symptoms that we associate with SIBO. Typically, SIBO, people will describe really uncomfortable bloating, worse at the end of the day, after they've eaten most of their food for the day. And then oftentimes they'll say, I wake up with a flat stomach, but then as soon as I eat anything, I have this bloated stomach. And some types of SIBO can be associated with diarrhea, others with constipation, and then others a mix of diarrhea and constipation. And the reason this is because there are actually two different types of SIBO that we typically classify. There's the hydrogen-dominant SIBO, and what this is various types of bacteria that when they eat the food that you eat and they produce gas, they ferment the food, produce gas, they produce hydrogen gas. And that's typically associated more with diarrhea. Then there are the methane gas producing critters, and they're actually not bacteria. They are something called archaea, and they, interestingly, they feed off of the gas produced by the hydrogen bacteria, and then they produce their methane gas. The methane gas is associated more with constipation, and that's because it slows the transit time through the small intestine, so more associated with constipation. And also interesting, they just recently in 2020, it used to be called hydrogen-dominant SIBO and methane-dominant SIBO, but they recently changed the diagnosis of methane-dominant SIBO to intestinal methane overgrowth, so IMO. And they did this because they found, well, one, it's not a bacteria, so it's not bacterial overgrowth, and then secondly, they've also associated more with overgrowth as well in the large intestine, or it's too much of it there. Another interesting fact about the methane that is very interesting. Some people will say that with their SIBO, they also have this weight gain. And the methanogens, the archaea, actually are associated with weight gain because they, one, slow the transit time. So you just have, or these are the two mechanisms they think. One, it slows the transit time through the small intestine, so just more time for your body to absorb the nutrients and calories. And then secondly, the bacteria there, they actually absorb more calories from the glycans in the food. So very interesting with this methane, or the IMO. I'm so used to saying methane-dominant SIBO. But that's pretty much how how or what SIBO is and how it works. And it's really important to know which type you have, if it's the hydrogen dominant or the methane. And when you have methane, you'll also have some hydrogen there too, because remember, it's feeding off of the hydrogen gas. But it's important to know which type you have because they are treated differently.
Well, how does one, first of all, acquire SIBO, and then how does one ascertain whether or not they have it, and then how does one figure out which type it is?
Yes. So, and actually, this is very interesting because in naturopathic medicine, we really want to treat the root cause. So, in terms of testing, we do, in addition to the basic SIBO breath test, which I'll talk about, we may want to do some other tests to see what is the root cause of the SIBO. And actually, there are lots of causes. The primary cause, most people think, is it's a slowing of what's called the migrating motor complex. And the migrating motor complex basically is the movement of it's called peristalsis. It's movement of food through the small intestine. And that primarily happens about 90 to 120 minutes after you eat food. So when you're not eating. And it moves food through the GI tract and through the small intestine. And some people, for various reasons, can have a dysfunctioning migrating motor complex. And one of the reasons is that after a case of gastroenteritis, the body produces antibodies to just like we would to any infection to the GI pathogen. And it's called the GI pathogen produces something called cytolethal distending toxin B. And our body produces antibodies to that. And unfortunately, the reason that we have movement through that MMC is because of vinculin. And so the antibodies to the CDTP, they mistake it for the vinculin and produce anti-vinculin antibodies that damage the migrating motor complex. Does that make sense? It's a case of mistaken identity.
I never even heard of this migrating motor complex, but what I'm learning from you is it seems to become active 90 minutes after a meal. And I know people that literally don't even wait, they're eating all day. And I'm thinking that can't be so good to just be snacking all day.
You are exactly right. And that is one of the things that I would tell someone, and that I wanted to mention too, is a way to keep, once you treat SIBO, is a way to prevent relapse, is to make sure you're not eating all the time and you're leaving at least 3 to 4 hours between your meals and allowing the body time to move the food through before you put more food in. It's actually a very important way so that you don't have to make a lot of huge dietary changes. You can still continue eating a really healthy diet. And there are ways to do that with these things to allow the body to work as it should. Exactly.
Has SIBO always been around, but we just didn't have the testing methods that we do today? And who gets this? Is it people of all ages, all sexes? Do children get this? Because I hear a lot of people talking about that they have it now.
Oh, absolutely. People of all ages can get it. And it is a relatively new diagnosis. They actually think that a lot of cases of IBS are actually SIBO. And it wasn't really recognized as much until more recently. I think I'm sure your other speakers have probably talked about it, and you have some experts on medical doctors, and they've been very helpful in bringing it about to the conventional medical community. Naturopathic doctors have been talking about it for a long time, but I think it is something that is more recent in terms of diagnosis, but has just sort of always been there.
So how does one decide, though? I mean, a person can't really self-diagnose it. They need a breath test. So where do they go? How do they decide to even go to a naturopath or a medical doctor to get treatment? Is it usually just because they're presenting with these GI symptoms? And
absolutely. And it's just this, like we talked about, the terrible bloating, oftentimes gas, constipation, diarrhea, and oftentimes when people actually finally get diagnosed, they've been diagnosed first with IBS for a long time. So once we do that, we want to rule out everything. We want to rule out other causes. So other things like children, even if they have a head injury of some sort, head trauma, well, there's a connection between the brain and the gastrointestinal tracts that can slow transit time. Or if a woman has I shouldn't say woman, man or woman, but oftentimes women, it's very common in women, have hypothyroidism that can cause constipation, slow transit time. You can, even after any sort of abdominal or pelvic type of surgery, you can have adhesions, which prevent the movement of food through the GI tract, and often very common gallbladder removal because the liver produces bile, it's stored in the gallbladder. But if you remove your gallbladder, sometimes, not always, that messes up the bile flow, and bile is very antibacterial. So we want to rule out all of these. And then medications, right? Your opioids and your PPIs, antihistamines, all of these can cause slowing of the transit and eventually lead to this. The more food in the small intestine is more food for bacteria to grow and feed off of over time, and just sort of gets out of control. So first we rule out all the other possible causes. And then next, in naturopathic doctors, usually people will find naturopathic doctors either because they already have a more natural bent, or they haven't gotten a diagnosis and they just can't figure out what's going on, and maybe, they want to try something else. So as a naturopathic doctor, we would do the same SIBO breath test that conventional gastroenterologists would do. And it's actually very important to make sure you get the test to make sure SIBO is actually what you have. And what this is you drink a glucose or lactulose solution, and then you blow into, so you actually have to do a special diet the day before where you remove any sort of carbohydrates or foods that bacteria could feed off of. So it's basically giving you a clean baseline, clean slate. The following morning, you drink a solution of glucose or lactulose. And then every 20 minutes for ideally 3 hours. There is a 2-hour test, but I prefer the 3-hour, and I'll explain why. Then every 20 minutes, you blow into, now they have it in like a tube or a balloon. You blow breath into a balloon. And what that's doing, it's because the glucose is actually can be metabolized by both humans and bacteria. So I prefer lactulose. Only the bacteria can digest, ferment the lactulose and produce the gas. So as the lactulose solution, let's say, goes through your small intestine, at the first 20 minutes, maybe you don't get any gas and the gas comes out your breath. You don't get any gas. Then the next 20 minutes, maybe there's a little, and so it measures the gas produced as it goes through the small intestine and can tell you if you have any overgrowth there. And it will tell you the types of gas. So you want one that has methane and a hydrogen test. And so this is important, like we talked about, because you need to know your level of hydrogen and methane gas, if there is bacteria there being produced. And the reason, and also because the treatment for hydrogen and methane dominance, or IMO, is different. And I like the 3-hour because typically someone with constipation and slower transit time, it's going to take longer, right, for it to get to the lower part of the small intestine where SIBO is actually more common. And so if you only test the first 2 hours, you may not actually, the solution, the lactulose, may not get down there and give the bacteria a chance to feed off of it. So once we figure out what type it is, then we can actually determine how we want to treat it.
So you mentioned something called transit time a few times. What is transit time and why is it important?
Yes, so transit time is the time it takes for food to move through the intestine. And if you have a fast transit time, it would go through really quickly. Slower transit time is usually caused by the methane archaea, and it causes food to move through really slowly. You have more likelihood of backup and buildup and constipation, and then foods there, overgrowth of bacteria. And so for someone who has SIBO, generally we see that. And so you just see that the glucose solution has a slower through, or the lactose solution is slower through the digestive tract. And so you want to make sure you give it time to get down to that lower small intestine to see if there is bacteria there that's going to feed off of it and then produce the gas that you will see coming out of your breath, or that will come out of your breath and they'll have in the test tubes.
Is there a normal transit time that people should have? And is there a way to test for it without a breath test? I mean, I like eating corn because everybody seems to know when the corn comes in and the corn goes out.
Because that will also test large intestine transit time too. So I feel like everyone's a little different, and you sort of have to know how your body feels. But typically it's that 3 hours through the small intestine, which is why we use that 3-hour test.
Great. You mentioned the day before people have to remove carbohydrate from their diet, but if you're a vegan or a plant-based eater, I'm trying to think, what would I eat? Because that's all I eat is carbohydrate, pretty much.
It's not a fun day, I will tell you that. But you are allowed, actually, though, no, I take that back. Depends on the test company that you use. For most of them, though, it's either chicken, fish all day, and only salt, no other spices or anything, because some of those have those FODMAPs in them, the fructooligosaccharides that the bacteria love and will feed off of. But a lot of them will allow either white rice or brown rice, but that's the only carbohydrate.
I could eat rice. I can eat rice for a day. That I could do. I do love rice.
And I think they also allow quinoa, possibly.
Wow, that's right. That sounds like almost as bad of a prep as for a colonoscopy.
I think it's actually probably maybe a little better.
Yeah, a little bit better. At least you get to eat. I'm fascinated by this migrating motor complex. Because I don't hear that talked about a lot. When was that discovered, and why is it so important? Is it important for people that don't have SIBO?
Oh, it's absolutely important. And it's, again, only, I don't know when it was discovered, but it is only when you're not eating. And there's debate about whether it actually happens with things like coffee, or if that's if that really won't get in the way, or teas or anything like that. Oh. But any source of calories, a drink like that probably wouldn't affect it so much. But it is very important because you want that movement and wave of food to allow your body to refresh and detoxify, which is why a lot of the great doctors will, GI, but all sorts of doctors will say, you want to leave a good amount of time between meals, but also between dinner and your first meal of the day, to give your body time to move the food through and digest it and do the cleaning waves and all of the cleaning it needs to do.
And that makes sense. So we know that if someone goes to a medical doctor and was diagnosed with SIBO, generally the first line of treatment is some type of antibiotics, maybe more than one, maybe even more than one course. And I know that for some people, they don't even work. I know when I had SIBO, I took 3 rounds of rifaximin and nothing. I didn't know that there was an alternative treatment. So how do naturopathic doctors approach SIBO?
Yeah, and it would be interesting to know, I'm sure that whoever you went to was wonderful and they determined the type you had, but actually there are some breath tests that only look at hydrogen and they don't test for methane. And so you really want to make sure the test you are taking, if someone listening is going to have a breath test for both hydrogen and methane. Because if you can treat methane SIBO, IMO, with rifaximin all day, and probably won't do the trick. So with naturopathic doctors, we do use pharmaceuticals when needed. It's personally, I prefer the herbal antimicrobials, which I'll talk about. But if they are needed, rifaximin alone is just for the hydrogen dominant SIBO. And in terms of an antibacterial drug and its effects on the microbiome, it's not terrible. And the reason I say this is because it's, one, been shown to be anti-inflammatory. So typically people with SIBO, all of that buildup, that you'll have a lot of inflammation in the gut or in the small intestine, so it can be helpful. And the second thing is it actually only stays in the small intestine. And so it typically doesn't destroy the good microbiome that we want in the large intestine. It only really targets the overgrowth in the small intestine. So that's a really good thing. And the reason it does this is because it's activated by bile. And bile, again, is secreted into the small intestine, and so it's active in the small intestine. And one of the naturopathic additions, if we were to use rifaximin, would be to add either a bile supplement, and typically those are only ox bile. So for someone who's vegetarian, maybe some herbs or foods. I would recommend foods and herbs, and there are specific supplements to increase bile flow, so you really get the rifaximin more effective. And interestingly, they've done a study that showed that rifaximin was much more effective when taken with bile. Again, because it activates it. And so there are some great herbs. Dandelion root, you can get organic dandelion root tea, bitters like bitter greens, apple cider vinegar, lemon juice. Those are some great things to increase bile flow. And then there's some herbal supplements you can do. And then if we were to use rifaximin, the other thing I like to naturopathic addition is something called partially hydrolyzed guar gum. It's basically a fiber supplement. It's similar in taste to acacia fiber that many people with IBS may be familiar with. I think one of the things that you are familiar with is like Heather's tummy fiber, which is acacia gum. And it's similar to that. And the reason it's helpful is because it actually brings the bacteria out to feed on. So you take it and then you bring them out to kill it. And then with the the methane dominant, you need to add rifaximin plus neomycin or metronidazole or another antibacterial. And unfortunately, those are not so great. Those are the ones that basically destroy all of your microbiome in your large intestine. So it would be my preference not to jump to the pharmaceuticals first line, especially if you have to treat methane dominance. So that's sort of our additions to our naturopathic additions to the pharmaceuticals, because sometimes they are needed. Then there is also the elemental diet. And I'll just get this out of the way first. Most people do not choose this. I always give someone all three options, right? Informed consent. To make sure they know the risks and benefits of all three options: the elemental diet, the pharmaceutical antibiotics, and the herbal antibiotics that we'll talk about. And what the elemental diet is, it's basically a pre-digested powder, similar to what they give someone for parenteral nutrition in the hospital. And so it's basically all digested, and it's a powder you mix with water, and then that's all you eat for 2 to 3 weeks. That is it.
Oh my God, that sounds terrible.
It is definitely, my choice would be last line. And there's several reasons for that. But the way it works is that you're just starving the bacteria, because it's all pre-digested nutrients. It's powder. It's digested in about the first foot of the small intestine. So the bacteria are not getting any food. And
what is the powder made out of?
They make it out of, it's like pure amino acids, dextrose, and some fatty acids, and then vitamins and minerals. So you have all your electrolytes, you have all your vitamins and minerals, you have amino acids that you need to survive. But the problem with this is that it's not very natural, right? You're also completely starving the large bacteria. And I don't like it because I think it in the wrong person can promote eating disordered behavior. I'm not a fan of it, although I will say that it has been shown to be one of the most effective treatments for SIBO.
Well, is it any more effective than, say, going to the True North Health Center? Dr. Ellen Goldhammer is an expert on this summit and just doing the medically supervised therapeutic water only fast.
I think that is an excellent diet. I mean, I actually never considered that, a 2-week water. It's beautiful. If you really didn't want to take the herbal antimicrobials and you didn't want to take the pharmaceutical antimicrobials and you wanted to do the water fast, that would be a beautiful idea. It would
It sounds better than the elemental diet. That just sounds nasty.
There are several, they used to have them where they really were nasty. And there was one, I think it was made by Nestle, and it's also really sort of not so great ingredients. And then there was some powders you could make on your own. Several companies have come out with better tasting elemental diets. Am I allowed to say names of supplement?
I mean,
Integrative Therapeutics has one called Physicians Elemental Diet, and it's actually not terrible. It is very, very sweet. So someone like yourself if your palate is not used to that, it would be disgustingly sweet because it's just dextrose. It's pure sugar, and then they add the flavoring. So it's a very difficult thing to do. So I think your suggestion would be brilliant.
Well, I'll tell you, that day of rice is sounding a lot better.
Yes.
And a lot easier.
So that is one option, though. You always have to give someone. And then the third is the herbal antimicrobials. And the herbal antimicrobials have actually been shown in a study. They did a randomized control trial that showed that herbal antimicrobials were just as effective as the pharmaceuticals. And I think it was just rifaximin they tested it against. I'm not sure if they used any of the rifaximin neomycin combinations, but they used 2 specific supplement brands in this multi-center study, and they were combinations of herbs. It was something called Dysbiocide and FC-Cytal, and that was by a company called Biotics Research, or Biotics. And then Metagenics is a very well-known company, and for them, they used Candibactin AR and Candibactin BR. And so those herbal combinations were shown to be very effective, and as effective as the pharmaceutical antibiotics. But there are some things and then I'll talk about the other combinations I like, but there are some things that are very important with herbal antimicrobials. One, you need to combine the herbs. So we use combinations. And the reason is because some are more effective at the different types of bacteria than others, and so we want to target them all. And then the second thing is that you need to rotate them so that we don't develop resistance to them. So similarly to how we can develop antibiotic resistance to the pharmaceutical antibiotics, your body or the bacteria can develop resistance to the herbal antimicrobials. And it's usually actually not as doesn't happen as much with the herbals, but it can happen. So what we'll do is we'll use either one of those they're already combined in one of those brands that I talked about before. You use 2 of those, and it's about 4 to 6 weeks. So something you have to know about the herbals is they take a little bit longer. But the reason is because they are sort of rebalancing to the body, and they also don't destroy the microbiome the way that your pharmaceutical antibiotics do. So that's why I really like those. They target the guys you don't want there, but don't destroy the rest of the microbiome. So then for your hydrogen dominant SIBO, the 3 herbs that I love in a combination, and it's 3 times a day. Take some of these 3 times a day for about 4 weeks, and then we sort of see how you're doing, is berberine, oregano oil, and neem. And they make specific supplements of these that are really, they're therapeutic grade and tested to make sure that's what they really contain, and that they don't have heavy metals and all of that. And then for your methane, it's allicin, which is the component of garlic, oregano oil, and neem. And the allicin is really important for methane because that is the one that targets the methane. And we use allicin and not just eating whole garlic, because people with SIBO are usually sensitive to garlic because it's got a lot of those FOS, those fructooligosaccharides. So we use a very potent garlic supplement. And usually that does the trick, but sometimes with methane and with other forms, you do need multiple rounds of treatment. And it's more common we see with the pharmaceuticals that you may get a relapse after you use them for various reasons. The other thing that is really important to include is something called a biofilm buster. And they found that the bacteria actually hide in something called biofilms. It's like a protective shield. And so that can be one of the reasons why people have very resistant SIBO, because the bacteria are there in these biofilms. So by adding a biofilm buster, or biofilm breaker, this is something I would actually add if we were to use pharmaceutical antibiotics as well. But you add something, they make various supplements, or N-acetylcysteine is also a great one that will do this, that will break up the biofilms and allow the antimicrobials or pharmaceutical antibiotics to work better. And there are various brands that will do that and help it work a lot better. And then there's a wonderful supplement called Atrantil. And it was developed by a gastroenterologist who discovered through research, they were doing research on livestock. And we know that livestock produce methane gas, right? Which is one of the reasons why eating a plant-based diet can help with our environmental pollution, because we reduce the methane gas. And so they found that feeding them these specific herbs, and one of them was cabracho, would reduce the methane gas. And so he took that research and applied it and thought, I wonder if giving this to humans could help their with symptomatic methane production in methane-dominant SIBO, or IMO. And so he put it together as a supplement, and it's actually very helpful for symptomatic relief of methane SIBO. They're not sure whether it actually gets at the root cause, not killing the archaea, the methane-producing archaea, but it's helpful for symptomatic relief and reducing that gas that's going to cause your bloating. And because the gas is what causes the slow transit time, it can just also be helpful in that way to help the SIBO.
What are the comparison of the costs of these various treatments?
Yes, so probably the antibiotics with insurance will probably be cheaper. Although I will tell you that rifaximin is not generic in the United States. It's only sold as Xifaxan, and it is very expensive unless you have the right insurance and can get a special savings card. If you don't, it's thousands of dollars. So that one in particular is difficult, but it's the neomycin and the other antibiotics with insurance would not be expensive at all. The herbal supplements can add up, not terrible, but they could add up over time for 6 weeks, maybe several hundreds of dollars. But if you have to pay thousands for rifaximin, I don't know. The elemental diet powder, if you were to go that route, it can add up, because that's all you're having for 2 to 3 weeks. It's not terrible because you're not buying any other food, but it's another expense.
What do most of your patients choose?
I have had one person choose the elemental diet, and she stuck with it the whole time and felt amazing afterwards. So much so that she didn't want to retest. She didn't feel it was necessary. So that's the only one I've had it. And then others, some people don't want to do the herbals, and they just are more, they just want antibiotics. No matter how much I talk about the destruction of the microbiome, if we have to add neomycin. And then, yeah, and then a lot of people do choose the herbals.
So with relapse, has there ever been any research showing which is more effective, or does it just depend on the person and also how compliant they are maybe with the treatment regimen?
I think you're completely right that it depends on how compliant. And then there are lots of things that I like to suggest to prevent relapse. So during treatment, I actually don't make a lot of or recommend a lot of dietary changes because, and like we talked about, unfortunately, some of the healthiest foods on the planet are the ones that are the bacteria love and are going to feed off of. So when I do, it's like recommend a low FODMAP diet. It's really only for symptomatic improvement and temporarily. But I actually think some people disagree on this. So they say, well, you should remove them to sort of starve the bacteria and while you're killing them. But I think if you're still eating any at all, you're still feeding them. So just eat the regular diet and allow them to be there, right? When you add, so they're there so you can kill them. That's sort of my approach on it. And the other thing is, we really don't want people to do a low FODMAP diet forever because you are starving the good bacteria you want in your large intestine that are vital for health. I mean, we're learning so much about the importance of the microbiome for health. And so by trying to starve the small intestinal bacteria that shouldn't necessarily be there, you're also starving the large intestine. So wouldn't want to do that for a long time. But there are definitely things that we can do to prevent relapse, and I think this is very important. I don't know if any one of the treatments is more effective for preventing relapse. I have heard that it is more common with the pharmaceutical antibiotics, but I don't know that for certain. I think it has to do with one, if you can add the things that make for example, if you use rifaximin, if you added oxbile, if you were okay with that, or a bile promoting supplement or herbs to make it more effective. They actually have, again, in studies, like I said, they've shown that it makes it much more effective. So just depends on the treatment approach and someone sticking with it. And then also if they've had it for a long time, and also if you add a biofilm buster, maybe they've had they've had it for a long time, that bacteria or the archaea has had a long time to perform, to create that protective shield. And then you take the antimicrobials and it can't get at it. So we want to break that up, get them out of their little protective shield so that we can kill them in the small intestine. But there are lots of things that we can do after we treat it to prevent relapse. So just without having to avoid those healthy foods, there are simple things we can do. So if we have foods that are bothering us, like some people, maybe it's sweet potato or beans or usually it's the starches or the fruits. Again, those really healthy foods, fibrous foods that the bacteria love. Just start low and slow, a little bit every day. You don't have to overdo it. So sort of just like training. If you haven't been training, you just want to start with a little bit and build up. So same thing with your gut. And then if you cook more of your veggies, so aim for like 70% cooked, 30% raw, something like that. That can be helpful because sometimes the raw foods are harder to break down, right? Once you cook them, you're breaking down the starch a little bit, making it easier to digest. Um, so that's something we really want to do. For fruit, if the less ripe it is, the harder to digest. So ensuring your fruit is ripe, that's really helpful. And actually, green bananas are really a great source of resistant starch. So that's a really great example. Once you allow it to ripen, that starch turns to sugar. So if your body can handle resistant starch, which has been shown to be very helpful for health, then a green banana would be great. But for someone with SIBO, you probably want to stick to your ripe fruit. And like we talked about, limiting snacking can help you prevent the relapse, because the more you eat between meals and snack, then you're not allowing that migrating motor complex, and you can have a buildup that will start all over again. Really recommend removing alcohol and caffeine for some people, processed foods and artificial sweeteners, especially because they've been shown to not be good for the bacteria in the bowel. So we don't know all of their effects, but definitely not great. Fermented foods, kimchi, sauerkraut, even though those are wonderful, they can be problematic for someone with SIBO. So maybe just for a short amount of time, you reduce them, but then introduce them back slowly. And sometimes maybe you want to take digestive enzymes with meals just to help break down the food a little bit more. So if you're recovering from SIBO, it's not that the larger food particles are not sitting there in the small intestine for the bacteria to feed off of. And then the last thing that's really simple, and I actually think you've talked about this before in a lot of your YouTube videos, is stress while we eat, like being mindful while we eat and eating in a calm state, because the digestion works when our parasympathetic nervous system is working. The rest and digest, it's called that, or it's in layman's terms, the rest and digest nervous system versus the sympathetic fight or flight. And when you have that, when you're stressed and when you've got that sympathetic nervous system going, your digestion stops. So it's really important, even though we're all busy, when you eat, try not to eat in front of your computer or on the go in the car. If you can, try to take that time to breathe and digest. And so there are some things that we, just those are just basic day-to-day things. And then addressing the root cause. So we talked about all the different causes, of possible causes of SIBO. And so we, at the very beginning, want to see if we can figure out why it happened. So did you have a case of gastroenteritis that has led to these antibodies that are stopping your migrating motor complex? Or do you have adhesions? Or do you, something preventing food from moving through? Or do you just need thyroid medication? Maybe you have hypothyroidism, or is it due to a drug you're taking? Maybe we need to address those and try to get you off of those PPIs, or hopefully, you're not on opioids long term, but we need to look at the whole person, the whole picture, and really get at the root cause. But because the most common cause they've found, or one of the main common causes, is that slowed migrating motor complex, one of the things that I will always recommend after treatment, usually for about 6 months, is some sort of a prokinetic. And what that is it's not a laxative. It's different than a laxative, but it actually gets the migrating motor complex going, or it moves through food through the small intestine. And it's usually there are pharmaceuticals or herbal supplements that can move food through the small intestine. So if you have antibodies to vinculin due to a case of gastroenteritis, you can take one of these prokinetics to make sure you are getting food through the small intestine, that it's not building up, and so you don't have an overgrowth of bacteria there that are able to, again, eat it, grow where they're not supposed to, produce that gas, and you get it all over again. And it's very common in the first 2 weeks after treatment to have a relapse if you don't do this, especially if reason you have SIBO in the first place is because you don't have a migrating motor complex that's working due to these antibodies. So this prokinetic is very important. And I know a lot of the conventional GI docs use the pharmaceuticals, which are very effective. I've actually never prescribed them. There's something called low-dose naltrexone and low-dose erythromycin. Those are some of the pharmaceutical options. And a lot of people have great results with those. The ones I usually turn to are herbal ones. And most of them actually have ginger in them. And ginger root is known, amongst many other things it does. It also promotes movement through the GI tract. So it's very helpful, and a lot of the combinations contain ginger, or you can just take ginger root alone. Some of them, there are several brands that I like that are specifically made for this purpose. There's something called Iberogast, which is a tincture, a tincture is basically take alcohol and soak out the herbal components that you want from the herbs. I don't always love alcohol because a lot of people don't respond well to even the small amounts of alcohol. There are ways where you can burn it off. You take the tincture and you boil it and it burns off the alcohol, but sometimes I find it's just easier to use other options. But Iberogast is very effective. Ginger root, there's one called Modal Pro by Pure Encapsulations. Motility activator. So motility is, again, that movement through the small intestine. Motility activator by Integrative Therapeutics. And there's one called SIBO MMC. MMC stands for Migrating Motor Complex by a company called Priority One. And that was developed by a naturopathic doctor who is very focused on SIBO. And so they've developed supplement lines specifically for SIBO of herbs.
Do you recommend that people actually go to a naturopathic doctor for proper dosage rather than just taking these names and buying them off the internet and dosing themselves?
Absolutely. Very, very important. Because it's also, a naturopathic doctor will, one, find your root cause, which is very important to make sure, well, one, do you even need this SIBO treatment in the first place? And two, you can treat it all you want, but if you don't address the root cause, then it likely is to come back. And I meant to say, speaking of root causes, they do have a test now, a new test for the antibody to vinculin. So people can actually test for that. But the second reason it's important to go to a naturopathic doctor or any doctor, make sure you get the right diagnosis. And then if you want herbs, a naturopathic doctor would be the right person, because sometimes maybe you have a sensitivity to garlic. And that is what we use primarily for methane. Maybe you have methane dominant SIBO, IMO, but you have a sensitivity to garlic. So we can mix things up and work with different combinations to get you what you need. And then also, I didn't say specifically any doses on here for that reason, because I think it's very important. Herbs are just like any medication. You need to look at everything you're taking. Make sure you don't have an allergy to something in the product you're using. They can interact with drugs just like other drugs interact with drugs. You need to make sure that it's not going to interact with anything you're taking if you are taking something. And just want to, do it all very, very safely. So thank you for mentioning that. I think it's really important. And for the elemental diet, you definitely want to do that under supervision, just as you would if you went to True North.
I think people also need to understand that whatever route they take, it's not a quick fix, SIBO. It's not like one and done pill.
I think that's also very important to note. You have to be proactive, and I think it will require lifestyle changes in addition to sticking with the treatment protocol. And just as with any treatment protocol, if you don't take it as prescribed, it likely will not be as effective or effective at all, because there's a reason your doctor is telling you to do it as they suggest it, because they either know that is safe and another way is not if you take too much, or not effective if you take too little. And
Or stop taking it too soon.
exactly, which is what so many people do with pharmaceutical antibiotics, which leads to this resistance that we have, because you don't kill all the bacteria. The ones that are there, the reason they're still there is that they've survived and the antibiotic, and they're the ones that have reproduced. And so then you have a whole new population that cannot be killed by the antibiotic. So exactly, you just follow your doctor's instructions.
If people get no treatment, could it eventually go away, or is it just here to stay?
That's a really good question. I don't have a good answer for that. I guess no treatment. If you did a water fast, that would be a form of treatment. But no treatment, I think it might be hard to kill the overgrowth in the small intestine. So my guess is that unless there's some other cause and it's not really SIBO, and there's something else causing your symptoms, that you may need to do something to get rid of the overgrowth in the overgrowth in the small intestine. And for some people who have adhesions that are preventing it, maybe something like visceral manipulation, which can be very effective, which can allow the food to move through. Maybe that in and of itself over time could help, but I don't know.
What's visceral manipulation?
Oh, it's a form of physical medicine where they will help move parts of the muscles and the body to release adhesions and tension. Mm-hmm. I do not do it, so I'm the wrong person to speak expertly on it. But I do know that it is very helpful for a lot of people.
What kind of healthcare practitioner does that? Because I love learning about new modalities.
Oh, yeah. I think many chiropractors may do it. And I think there's possibly a certification. I know a lot of naturopathic doctors do it.
That's so interesting. I'm just really stuck on this migrating motor complex, because is there a way we can get ours tested to see if it's working properly?
Oh, I wish I knew. I'm sure there is. I mean, you can do like a barium swallow. You can, where you take barium and they can see how long it takes to get through. Well, I guess that's more of the esophagus. I'm sure there's a way. I'm sorry, I should know this.
That's okay. Because I thought maybe another person to have on the summit if there's a modality that's
there is a way to do it. I'm sure, taking something that they can x-ray and then watching it through.
That's interesting. I've heard you mention a few times during the course of this interview, PPIs, and I know what those are, but I'm not sure everybody else does.
So those are proton pump inhibitors. And people take them usually for GERD, gastroesophageal reflux disease, or just reflux heartburn. And it's the conventional thought is that it's due to too much acid in the stomach. There's some other thoughts in the naturopathic world as well about the causes. But it's thought that there's too much acid, hydrochloric acid in the stomach, and it bubbles up into the esophagus through the lower esophageal sphincter and then burns the esophagus. And you were supposed to have a closed lower esophageal sphincter that prevents this very harsh acid from going up into the tissue in the esophagus. The stomach is made to withstand that. And so they'll give these proton pump inhibitors to prevent the acid release by the cells in the stomach, by the parietal cells in the stomach. They are activated by protons. And so what happens is you take these, you have a decrease in hydrochloric acid. The problem is that hydrochloric acid is actually important. It is used to prevent bacterial overgrowth. So our bodies were designed knowing that the food we eat may not always be clean. It may contain bacteria. And so when you eat it, it goes into the stomach. The hydrochloric acid is supposed to kill a lot of the bacteria that shouldn't be there. So oftentimes when people take a PPI, they're not killing that bacteria. So that's thought to be one of the causes of eventual overgrowth of bacteria. It also reduces your absorption of very important minerals and vitamins, especially B12, calcium, zinc, because the acid is important for that absorption. And so now they're finding that long-term PPI use is linked to osteoporosis, fractures, pneumonia, and sometimes C. diff. And the reason this is because it's not killing this bacteria. And then depletion of your vitamins, minerals. B12 is extremely important. We know that intrinsic factor is released in the small intestine along with your acid by the parietal cells. And so when you're stopping that, you're not getting the intrinsic factor. The way it works is when you have B12, so the intrinsic factor carries that B12 in your stomach all the way down to the end of the small intestine to the distal portion where it's absorbed in the ileum, the distal portion of the small intestine. So when you take these PPIs that are not designed to be taken for more than 2 weeks, but you hear of all these people taking them for years, and it's really not a good thing in my opinion.
Right.
The naturopathic, one of the thoughts in naturopathic medicine is that actually GERD, the reflux, can be due to low stomach acid. And it's not always the case, and there are ways to test your stomach acid to see if you have too much or too little. But the thought is that when you don't have enough stomach acid, you get more bloating, which pushes up into the lower esophageal sphincter to open it up. And that allows the acid into the esophagus.
Wow. Yeah, I've seen a lot of people get rid of their GERD just by switching to a whole food plant-based diet without all the processed foods and oils. And that was my husband's case. He had a endoscopy and he was on those medicines, and then he switched his diet from a regular vegan diet to a healthy one and no more proton pump inhibitors.
I 100% agree.
Are there natural, we probably don't have time to go into the whole GI tract because it's pretty long, but since there's naturopathic approaches to SIBO, are there naturopathic approaches to these other GI diseases like reflux or C. diff or constipation, diarrhea, those kind of things?
Absolutely. So with GERD or with reflux, one of the things we talked about before, ginger can be very helpful. With GERD as well. And then and an artichoke can be very helpful. Artichoke, the herbal extract. One of the things we usually use is a soothing demulcent because that esophagus is irritated. And so deglycerinated licorice, DGL, is often used and is very, very soothing to that esophagus. And there are supplements that, oftentimes we can mix our own herbs, but oftentimes it's nice to use supplements that come pre-made and that are designed for specific conditions. So they make, one of the supplement companies, Integrative Therapeutics, makes a great DGL that's chewable. And then also one called Heartburn Advantage. That is a mix of artichoke and I can't remember what else is in there. I think there's some ginger and artichoke, but it's wonderful for heartburn. So that's something we would do. And the reason we use DGL, deglycerinated licorice, is because when it doesn't have that glycyrrhizin removed, it can actually cause hypertension, increase in blood pressure, because it deactivates usually your cortisol is deactivated to cortisone. And the glycyrrhizin component prevents that deactivation. So you have too much cortisol, which can increase blood pressure. For other things like diarrhea, we would, try to figure out the cause. So is it gastroenteritis? Did you have a bad case of food poisoning? Maybe we need to figure out Are you not digesting your fats? That can cause, if you are eating more healthy fats, avocados even, then you're not digesting your fats. You can have fatty stools, diarrhea. If you don't have a gallbladder, you're not going to be digesting your fats. Little kids, of course, with cystic fibrosis, they don't have the pancreatic enzymes. There are lots of things we'll do. And actually, so again, always important to find the root cause. There's now some great stool tests, functional stool tests, to figure out, do you have overgrowth of bacteria even in the large intestine? So bacteria is supposed to be there, but you can have an overgrowth of certain types. They're opportunistic. So you're supposed to have sort of a garden, a nice neighborhood, a mix of bacteria. But there are some guys or girl bacteria that will take advantage of the situation and will push the others out. And so you can just have an abnormal balance called dysbiosis. You can have yeasts, candida, parasites, even very common. Most people think they don't happen in the Western world, but they actually are very common. So even worms. So these stool tests, they have some great ones that actually look at the DNA in your stool, look for the specific DNA of these bacteria, yeast, protozoa, worms, and H. pylori. They can tell you just from looking at a sample of your stool, either 1 day or 3 days that you do it, what you have in there. And they can also tell you, do you have enough pancreatic enzymes? Are you breaking down your fat? Is there too much fat in your stool? There's even something they can tell in there called beta-glucuronidase. And that is really important because once estrogen goes through the liver to be metabolized, it goes through phase 1 and phase 2 digestion. This is probably too much to get into now, but after it goes through phase 2, it is a glucuronide gets attached, and the beta glucuronidase is, we want some, but it's produced by a lot of this dysbiotic bacteria. And so if you have too much beta glucuronidase, it removes that attachment that your liver put on and allows estrogen to be recirculated through the body, so it can lead to too much estrogen. And you want the right amount. You don't want too much, because then you have all of the estrogen dominant related conditions. So having a very healthy gut is very important. And in naturopathic medicine, actually one of the first things we're taught is that all health begins in the gut. It is where you always start. Look first at the gut. What are people eating? That's always where you start. Because as you said, you can fix so much just with changing the food. But then if maybe there's been damage done for various reasons, then we want to find the root cause. And we're so lucky now with all of this new testing that we actually can look for all of these things in the stool.
It's amazing. So Dr. Berg, what is the truth about GI health?
I think it would be that all health begins in the gut, and it all starts with food, to be honest, because if you have a healthy whole foods diet and you have those healthy eating practices we discussed, then hopefully you don't have these problems in the first place. But even if you do, for like we talked about all the different reasons, then you treat them. And the way to prevent them again is with the healthy whole foods diet, stress reduction, allowing your body to work the way it's supposed to.
That's great. Health begins in the gut. I love it. Thank you so much, Dr. Berg.
Thank you.